Most of these patients have been dealing with pain for X amount of years. They've been through medications, injections, they've been through the gamut of treatment, and now they're at the point where they're considering surgery. So a lot of times that's a scary process. And then we get on the other realm, we get patients that have had 6 weeks worth of leg pain, and there are younger patients, they have a disc herniation, and they just really want to get back into their everyday life. So it's a very variety of patients. Spine surgery is a big decision to make. We have a lot of patients that come in and they are determined that they need spine surgery, and sometimes that's not the case. Sometimes we can treat their condition with a medication, with an injection, with physical therapy. So even though I work on the surgical side, surgery is always the last option. So I think it's explaining to the patient why we're doing what we're doing. And then the patients on the flip side that do need surgery, I think it's just really explaining what's going on with them, going over the imaging with them. And I spend a lot of time with new patients because I want to make sure that they understand it. Maybe they've been offered surgery and now they're seeking a second opinion and they really don't know what's going on. So I really try to take the time and go over their imaging with them, explain what's actually happening with their body, and explain if a surgery is an option or if it's an injection or should we try medication and why we're doing it. I want to make sure that they understand what's going on with them and why we're doing what we're doing. I have a huge family, so I like to do different activities with them. I love to travel. So anytime I have the chance to go to a different state, go to a different country and actually experience that culture, I take it. And I love to play tennis. And I have a dog named Elvis. He's a beagle, and I've had him for 9 years. He was actually a graduation present. And I love just spending time with him.